Hello, my name is Georgia Roark. I am a 7th semester nursing student. Today is September 14th at about 2 o'clock in the afternoon. And today I will be doing insertion of a nasogastric tube as well as meds through the NG tube and removal of the NG tube. So first I'm going to start with insertion of the NG tube. So before I go into the room, I want to make sure that I have a doctor's order for it and what kind of tubing I need. So I've got my tubing here. Ready to go, and I'm going to go ahead and enter my patient's room. I'm going to do hand hygiene. Hi, my name is Georgia. I'm going to be your nurse today. I'm going to provide for privacy, and I'm going to ask, can you tell me your name and date of birth? Perfect. I'm going to put the bed up to a good working height for me so it doesn't hurt my back. And I'm going to tell my patient, today we're going to be inserting an NG tube because the doctor has it ordered. I'm going to go ahead and put a towel on my patient just in case it's messy. And I'm going to go ahead and get my gloves on. So before I insert the tube, I want to make sure I assess my patient's mental status as well as assessing for if my patient's had any GI surgeries or the patency, and if they have had any, if they have any deviated septums. And I'm going to get a new glove because this one's not turned on. All right, so I'm going to go ahead and check the patency of his nose. I'm going to hold one side and have him breathe, and have him breathe. Okay, and I'm going to go ahead and look up and assess which side of the nose I'm gonna use. I'm on the right side of the bed because I'm right-handed, so I think I'm going to use the right side of the nose. So I'm gonna go ahead and get my tubing ready, out and ready. Throw this away. I'm going to wrap it just to make sure that it is not stiff or uncomfortable. And I'm just going to set this here and have it ready. I'm going to go ahead and get my tape ready. I'm going to need several pieces. And one I'm going to split halfway down for when I put it on his nose. Okay, I'm going to go ahead and measure the NG tube. So to measure, you go from the tip of the nose to the ear, and then from the ear to the xiphoid process. Okay, so then I'm going to take that and I'm going to mark it with a piece of my tape so that I know how far to go so I don't go too far. All right, so now I'm going to go ahead and lubricate my catheter. All right, and I'm going to measure the tip of the catheter 4 inches so that there is good passage into the nostril. And I'm going to go ahead and give my patient water, and I'm going to have him take sips of water as I progressively go down through the tube, or through the nose. So I'm going to go ahead and I'm going to have him put his head back until I reach the oropharynx, and then I'm going to go ahead and have him go forward, lean forward. So I'm going to go towards the opposite direction with the tube pointed down. All right, so I'm going to go ahead and start insertion, and I'm going to have him take those sips of water about every 2 to 4 inches that I go down. I'm going to check the mouth to make sure it's not coiled up in there, and then I'm going to keep inserting until I get where it's supposed to be. And then I'm going to go ahead and tape it to the cheek. And if I were to meet resistance or anything, I would take it out, re-lubricate it, and try again, possibly in the other side of the nose if need be. Okay, so I'm gonna go ahead and make sure that's secured on there good. I'm gonna go ahead and check for placement. I'm gonna get a pH strip. There's 3 ways to check for placement. So the most accurate is the x-ray, which you do when you first put it in. And then there's also the pH and checking for air. So I'm just gonna go ahead and do the pH here. So I'm gonna take this and pull back some of the contents. And I'm gonna check my pH strip. Okay, and I'm gonna go ahead and attach it to the top of his nose. Make sure that it's secured on there good. And then I'm also going to secure it to his gown. I want it to be looser so that he does not have any pulling or tugging, so that it doesn't fall out. Alright, are you still doing okay? Perfect. Okay, I'm gonna go ahead and take his towel away, and I'm going to check my pH strip with what it's supposed to be, and it's below 4, so that's good. That means it is in the correct place. So then I would put my patient down to the lowest level and have him sit up at a 30-degree angle at least, and I would have this hooked up to suction or clamped, whatever the doctor's orders was. And then I would go document what time I placed it, how my patient tolerated it, and what the residual looked like. So now I'm gonna go ahead and dispose of this and do my med feeding. So I'll be giving my patient 2 medications. So first I would make sure before I came in the room that my patient's medications were compatible, that they could be crushed, and also did 2 med checks before I entered the room. So I would come in the room, check my meds, ask, Mr. Jones, can you tell me your name and date of birth? All right, so I checked that to the meds, and that is correct. So I'm gonna go ahead and give those. Move this out of my way. Okay, so what I'm gonna do first is open each med individually. All right, and then I'm going to take and crush each med as well individually. So I'm going to put my med in the bag, and I'm going to crush it in the pill crusher until there are no chunks, and that it will mix well so it doesn't get stuck in the tubing. All right, I'm going to pour that in. Make sure to get as much of the med as possible. All right, and pitch that. And I'm gonna go ahead and do my other med. And obviously I would have on, had changed my gloves. Make sure it's crushed good so that there will be no lumps or blockages. Perfect. And I'm going to go ahead and put about 20 milliliters in each medication to mix them up. Make sure not to put any air in there. All right, and I would mix them up. Good. Making sure that there's no clumps or anything that will get stuck in the tube. just as best as I can. Okay. So I would, obviously if it was a new occurrence, I would check placement before giving the medication. But since I already checked placement when I inserted the tube, I'm gonna go ahead and give my meds because I know it's in place. So first I want to flush with 20 to 30 milliliters of water. All right, Mr. Jones, I'm gonna go ahead and give you your medication, okay? Alrighty. So I give the 20 milliliters, making sure that there are no bubbles and that I don't instill any air. And immediately clamp it so that there's nothing that comes back into it. And then I'm gonna give my first medication. And I want to get as much in there as possible. Without having any bubbles. All right, so again, my first medication. I'd make sure that he is sitting up at least 30 degrees in the bed, so that there's no aspiration. I'm gonna clamp it and flush again with 20 milliliters. And then I'm going to get my last med, getting as much up in there as possible without having any bubbles. You still doing okay, Mr. Jones? Good. And I'm gonna clamp it and flush it one last time. Perfect. And I'm gonna clamp it. And then I wouldn't want to put him on suction or anything immediately. I would make sure that I let that settle and make sure that all of the meds are through the tube. And I'm going to clean up my mess. And I would go document how much I flushed with for each med, and in between how my patient tolerated it and what meds I gave. So now I'm going to go ahead and do a tube removal. And I'd have clean gloves on. I'd come in, tell my patient what we're doing. We're removing because the doctor has an order placed for us to remove the tube. So I'm gonna go ahead and, before I put a towel on him, I would assess the bowels in all 4 quadrants until I heard bowel sounds, up to a minute. And then I would go ahead and place my towel. And I would check for placement. So I'm gonna go ahead and do the pH strip. So I pull back some contents. And check my pH strip and let that set. I'm gonna go ahead and undo my patient's thing from its gown and off his cheek and move his water and have him give him tissues in case he needs them before or after removal of the NG tube. So I've checked it's in place, which means it's good to go. And I can go ahead and remove. I'm going to have my patient take a deep breath, and I'm going to quickly pull out the tube. Mr. Jones, can you take a deep breath for me? All right, I'm going to remove it. Okay, and I would check the tip, make sure it's intact. And I would fold that up in the towel and dispose of it. And then I would make sure my patient tolerated okay. I would set him back down to a safe, the lowest position, and make sure that he's comfortable. And then I would go and document the removal of the NG tube, how my patient tolerated it, and maybe what kind of residual, as well as my GI assessment.